So welcome everyone to our September Talks on Tuesday webinar, Postpartum, Recognizing and Supporting the Parent-Child Relationship. This is the first webinar in our two-part series on this topic. The second part will be on October 5th at 12 p.m. Since you guys are all registered today, you are automatically registered for the second part. So no worries on having to re-register for that. My name is Lisa Terry. I am an early intervention professional development consultant on Virginia's professional development team with the Partnership for People with Disabilities at VCU, which I know is a handful to say. I'll be hosting today's webinar and providing some backup support. We also have Dana Childress and Corey Hill on my team who will also be providing some backup support today. Just some logistics in the email that you received with the login details. There were 3 handouts. I'm going to go ahead and post those links in the chat box so you can go ahead and access those in case you missed them. But if you are a hands-on learner like me, I like to print them out and take notes, and then I like to go back and revisit that information later. So hopefully I try to retain it a little bit more. Now I am super excited to introduce our presenter today, Telisha Woodfin. Many of you may already know Telisha through her work through the Part C state office. So I'm going to go ahead and pass it to you, Telisha, so you can share a little bit more about yourself and get us started.
Thank you so much, Lisa. Hello, everyone. As Lisa stated, my name is Telisha Woodfin. I'm a monitoring consultant for the Richmond and Tidewater regions with the Part C state office. Additionally, I'm the founder and lead postpartum doula at Live Love, a postpartum family support agency. Today, I get the privilege of combining my passion for early intervention with my other passion, which is postpartum. I have been providing informal supports to families for a few years and decided to begin the process of becoming a certified doula last fall. And as of last week, I am a certified doula. So I am super excited about that. So all of those letters that you see up on the screen, that's what that CD stands for. I'm also certified in educator of infant massage. So those are those other initials that you guys see there. Thank you so much. And I saw some social workers joining us. So yay, social workers. I also have a master's degree in social work as well. So I'm so glad that you guys are joining us today. So as Lisa stated, our today's topic is going to be postpartum, recognizing and supporting the impact on the parent-child relationship. This is one of a 2-part series, and today our objectives are to define postpartum and how it applies to early intervention, explore the needs of a family postpartum, discuss the role of an early interventionist, and provide strategies that support the parent-child relationship. As an early interventionist, I'm sure that you all have interacted with different types of families made up of individuals that may identify as male, female, non-binary, cisgender, or transgender, just to name a few. And it's important that we acknowledge that childbirth is no longer considered a gender-specific event. As a result of that, throughout today's presentation, you will hear me use the term birthing individual rather than mother. And the reason for that is to be inclusive of all individuals that give birth. In early intervention, we deliver family-centered services that are supported by coaching as a means of interacting with our families. This delivery is rooted in the belief that the best way to meet a child's needs is to honor the parent's choices, involve multiple family members, build on the family's strengths, and to establish a collaborative partnership with families in a way that is individualized, but also flexible. So in the beginning, there are always questions, right? From referral sources, from families, from us. Our relationships with families is established by actively listening to their concerns and priorities and asking important open-ended questions to get a deeper understanding of who they are, what they value, and determine how we can help. This is not a singular discussion, but rather an ongoing one that can begin at the central point of entry or intake and continue throughout our time with families. Our early interactions with families typically start with discussions about birth history. In chat, I'd like you to type in some of the questions that might be asked when gathering birth history. So what are some of the things that you guys ask? Whether it's at intake or doing assessment, maybe you're reading reports from the doctor. So what questions are you already asking about birth history? Complications, yep. Was the birth full term? We definitely want to know about those complications. We want to know what their age was at gestation. We want to know if we have preemies, right? Yeah, was it a C-section, vaginal delivery? Any medications? How was the birth experience? Okay, Tracy. We try to read those reports. Yes, tell me about your pregnancy. What's the birth order? Okay. General questions. They pass newborn hearing screening. What's your support system? Good, good. Any special needs because of the birth experience? Great. Those are all good questions. I'd like you to think about, are our questions child-focused? So are we covering age, gender, race, ethnicity, reason for referral, confirming those things? So we know that oftentimes the doctor will refer for one reason, and sometimes the parents' concerns are different, if any at all, right? Then we have prenatal care. So was there alcohol or drug use, any diagnosis that might impact the pregnancy? What type? We heard that a couple of times. That was in chat. What type of delivery was it? What's the gestational age? Definitely want to know about birth complications, medical history, surgeries, diagnoses, medications, developmental history, if there is some, right? Especially depending on the age of the child. We want to know about their day. We want to know what their schedule's like. Are they eating, sleeping, playing? What does that look like? Health insurance. So those are things that are really focused on the child. Or are we parent focused? Do we ask about the birth story? And somebody mentioned that. Somebody said, what was your birth experience? Were there previous pregnancies? So that could be birth order, but that's also a different question, because birth order, how it is explained by the parent, may leave out if they've been any previous miscarriages. So it's important to be intentional about those questions. Any perinatal or postnatal diagnosis? Is there any postpartum support, parenting style, how they like to communicate? Or are our questions family focused? Not only that, but what is our intent when we're asking these questions? Are we truly asking these questions to understand? Or is our focus more on getting it done? Like, we have to be honest about that with ourselves, right? I'm not asking you to tell me, but we have to ask ourselves, why are we asking these questions? Most of us have entered this work because we have a heart for people. We love the babies. We want to do everything within our power to help them succeed. We must remember, though, that babies come in a package that we call family. We must remain family focused in all of our work in order to make the greatest impact. With that being said, let's talk postpartum and how we can use the information we gather, if any, about this period to inform our work with families. So what is postpartum exactly? It may seem like a silly question, but I will tell you, most of the education that I provide as a postpartum doula is really just explaining what postpartum is. If you Google postpartum, you will get over 29 million results, with the first and many thereafter being about postpartum depression. And that's typically what most people think about when I say postpartum. It's immediately equated with postpartum depression. Because of this, I want to share a foundational definition of postpartum for us to use as we move throughout today's presentation. And it's really just to ensure that we're all thinking about this in the same way. So Webster defines postpartum as occurring in or being the period following childbirth. Simple. Traditional postpartum has been described as lasting about 6 weeks, Or however, medical professionals and other researchers have begun to consider that this period can vary from person to person. The quote on the screen from Root Therapy sums it up. Postpartum can be like arriving to a party right when everyone is leaving. At first glance, it seems the baby is here and the pregnancy is over. However, what is often overlooked is the interim period postpartum, that transition to one's pre-pregnancy state, or what I sometimes call your body's return to being a party of one. If you have birthed a child, then you know that it can take months, sometimes even years, to fully recover from pregnancy and childbirth. Recovery meaning the time that it takes for the birthing individual's body to return to its pre-pregnancy state. As you can imagine, this will vary from person to person and can be impacted by physical, emotional, and psychological factors. The weeks following birth are a critical period for a birthing individual and their infant, setting the stage for the long-term health and well-being, for their long-term welfare and well-being, as well as the impact that that has on the birthing individual. During this time, a birthing individual is adapting to multiple physical, social, and psychological changes, recovering from childbirth, adjusting to changing hormones, and learning to feed and care for a newborn. I'd also go so far as to say that caregivers through adoption, foster care, kinship care, or surrogacy have a similar transition. Maybe not from the perspective of the physical recovery, but they still have that adjustment that they're making to the change in their lifestyle. And maybe things that they may have to do a little bit different because they have a baby there or a child there that they're now responsible for taking care of. In chat, I'd like you to share what you know or what you have heard about the topics that are on your screen. So again, those topics are physical recovery after childbirth, emotional adjustment, and any lifestyle changes. What are some things that you know or have heard about those things as it relates to postpartum? You can type that information in the chat. Yes, I will say while you guys are typing that, you know, there seems to be this culture of bounce back right now after childbirth. Parents are often not given enough time to do these things. Yep, emotional swings, little sleep. It is hard. You are absolutely right, Marty. I've had young mothers state that they feel alone, overwhelming, sleep deprived. Yeah, rush to go back to work. That's that social pressure. Returning to day-to-day work-life balance, which does it ever really balance? I'm not so sure. Sleep deprivation. Unhappy with the body. Absolutely. You know, people say, oh, you've been pregnant, you know, how old's the baby? And they're expecting you to be at the gym all the time. Listening to your body. And you also have COVID worries on top of all of that. So thank you guys for sharing those things. Those are all things that we've heard. Some of us that have had children ourselves or are caregivers ourselves, we've heard them, we've experienced them, but also we've heard other people say them. You know, and it can be very isolating and it can be very overwhelming and it can feel very lonely. And so remembering that when we're going into homes, that's really important because we're in a very special and sensitive time in a family's life. So what does this have to do with early intervention? Well, early intervention naturally intertwines with postpartum because of the young age of the children we serve. So we're not only serving the most vulnerable citizens, but we're often doing that during one of the most sensitive times of their lives. As early interventionists, we understand the importance of acting early to support young children with developmental delays and their families. In Virginia, we promote the use of natural learning environment practices, and we have adopted coaching as a means of interacting with families. This means of interaction is grounded in the notion that children learn best within the context of their everyday routines and activities, affording us the unique opportunity to help parents interact with their child in a way that builds their confidence as a parent and a nurturing relationship with their child. We support parents to support their children. That's what we do in early intervention. So how can we support families during the postpartum period as they support their children? On the screen is an empty box. In chat, I'd like you to share some things that you think you might need or that might be helpful for you to take with you as you go into families' homes during the postpartum period. I'm not talking about toys or other tangible items, but rather abilities that might help us as we support children and families. Patience, absolutely. We definitely need some patience. Active listening. Empathy. Great. You guys are just going in on this. I love it. Compassion. Yes, that's a good one. I'm seeing a lot of awareness. That's important too. Yes. I've seen several of those. Let's make sure I didn't miss anything. Listening and giving space. Yep, absolutely. Absolutely. So thank you for putting those in the box for me. So we want to take those things, and there are probably countless others. Like if we take the time and we sit with what would we want, right? So oftentimes when we're thinking about families, we can lose sight of just the basic things. And so what would we want during this time period? What did we need and we maybe didn't get that we would have loved to have had? And so sometimes that's what I reflect on when I am working with families. And that doesn't take away from holding that space, because everybody is different. And it's important to know that you can go into families that may have the same, what may appear to be the same demographics, the same setup, their ages might be the same, but they can be very different. So it's important that we listen and we give space. What that space is, we don't take up the space with our own thoughts, with our own feelings, with our own emotions, but we allow others to have that space to fill it themselves. Thank you, Lisa. As early interventions, we not only bring our knowledge, skills, and abilities into the homes of families, but we also bring the fact that we are human. And many of us enter this work because we believe in what we do. We have a genuine concern for the overall health and well-being of others. We are sowers, planting seeds in each family that we are privileged to meet by sharing ways to support healthy child development. Lisa, can you clear the box for me? Given what we just discussed about postpartum as a time of adjustment for birthing individuals, I'd like you to think of some ways that you think postpartum might impact the parent-child relationship. What are some things that you think, some ways in which you think postpartum might impact that? Resentment towards the child. Resentment in oneself, challenges bonding, feeling helpless, disruption in engagement, not feeling close to the child. Yeah, lack of energy, because we need it, right? Attachment, overprotectiveness, low tolerance, parental confidence, that's a big one. Yeah, stress and fatigue, isolation, lack of sleep. Lack of sleep. Oh, where does the sleep go? Also happiness. Yep. Yeah. Because is it possible to be happy and overwhelmed at the same time, or happy and stressed at the same time? I think it is. I think stress sometimes we can think of as being a bad thing, but you can also be stressed from things that are really exciting. So stress doesn't doesn't differentiate. It can come with good things and it can come with bad things as well. And oftentimes what happens is parents are dealing with conflicting emotions. They're excited about having this baby, maybe, because some parents aren't, depending on how the child got here, whether it was planned or unplanned, or maybe it wasn't even something that they wanted. It could have been through some type of sexual assault or trauma that they experienced that landed the child here. So many different things that we have to think about. So one way that postpartum impacts the parent-child relationship, which someone mentioned earlier, was attachment. And Ruth Newton, she's the author of The Attachment Connection. Her quote is on the screen. She proposes that trust is the foundation for a secure attachment. It is also how home is carried with us wherever we go. So think about that. Trust is the foundation of a secure attachment. Attachment between a child and their caregiver can be understood as a mutual, secure connection. We aren't just talking about caregiving responsibilities, but the ability to understand, anticipate, and attend to a child's needs. And those are completely two different things. So we can go through the motions of caring for someone and not be connected to them. The attachment piece really pulls in that connection. So attachment is a reciprocal process that for the infant and adult alike is nurtured through eye contact, touch, and closeness. And one of the things that we talked about when I was getting my certification for infant massage was just the power of touch. And there's so much research that supports the importance of touch just for survival. And looking at children that were in orphanages that were just being cared for, so being fed, being changed, but not being provided nurturing touch, and comparing those to children that were provided that, and just looking at how they fared and what their lifespan were. And some of them didn't make it. Some of those children died. So touch is essential to our survival. It is in the context of this connection that a child develops a sense of security and trust in their caregiver, a sense of security and trust that eventually extends to the child's security in themselves and the world around them. So at birth, babies are completely dependent on their caregiver to help them manage and tolerate their emotional and physical states. When parents respond attentively to their baby's needs, they are helping their baby's minds and bodies shift from a state of distress to a state of calm, organization and balance. We call this co-regulation. So co-regulation supports self-regulation, which is learned over time through relationship. This process is vital to the development of babies' nervous systems as well as brain development. Positive relationships literally help babies to grow. So babies don't just need milk, whether it's breast milk or milk from the chest or bottle fed, but they need positive relationships to grow. Like babies, parents can also be deeply affected by the attachment process. And I saw some things that you guys mentioned about the parent in the chat. So thank you for adding those. The sense of closeness can bring up past trauma, or it can be the beginning of healing. Forming relationships, whether with a child or an adult, requires some level of connection. Would you guys agree with that? Making those connections can be challenging, especially because we all bring our experiences into the relationship with us. It is those experiences that inform our actions that result in what I like to call relationship misses or doubts or even fears. So 3 things that can interfere, these aren't the only 3 things, but I'm just going to talk about 3 things that can interfere with the ability for a parent and baby to get to know and understand one another. So the first is a traumatic birth experience or other health concern. So I want you guys to think about a car accident. And so if you've ever been in any kind of car accident, we'll just say that you were rear-ended. So you can have 2 individuals that are rear-ended with the same impact of speed from the other vehicle and have 2 completely different experiences with that. You may have the other one that by the next day, they're ready to get back into the car and they're ready to drive wherever they need to go. The other one may be more apprehensive, and every time they have to put on brakes, they maybe have some type of internal response to that. It's important to remember that a person's trauma is their trauma experience is determined by them, not by everybody else. So we don't get to define things as traumatic for people. It's how they interpret it. And oftentimes when I'm talking with folks that I'm supporting, I will ask, what was the birthing experience like? And they often begin by telling me what other people say it was like. Oh, it was a quick delivery. It was fast. Well, I can usually tell if that's something somebody has said and they're just repeating. And I want to know what that experience was like for them. And because they're not often asked that, it can take a few moments. And I entertain the silence, which can be uncomfortable at times, but it's important to give space, as someone said earlier, listening and giving space for people to share their experiences and not to discount it because your experience was similar or the same, because we know, as I just stated, that trauma and the experience of trauma is determined by the individual. The next thing that can impact that parent-child relationship is differences in temperament between the babies and their caregivers. Also, postpartum mood disorder. So we're talking about baby blues, depression, anxiety. There's even postpartum mania, postpartum psychosis. These things can make it really challenging in the attachment process. Additionally, birthing a baby or raising a child can also bring up the caregiver's own childhood relationship experience during a time when they are already vulnerable to experiencing mental health symptoms as a result of the postpartum transition. So caregivers with a traumatic or difficult, again, by their definition, family history might find that despite them wanting to be present as a parent, the relationship with their child evokes fear, anxiety, and sometimes even numbness. In fact, research shows that children of birthing individuals with depression and other mental health challenges are more likely to exhibit developmental delays, feeding problems, sleep difficulties, and behavioral challenges. That was a lot. That was a lot of information. So I want to recap because I want to make sure that in the midst of sharing all that I share, that you guys walk away with some key points from what I just shared. So point one, during the postpartum period, a birthing individual is adapting to multiple physical, emotional, and lifestyle changes. Point two, they are recovering from childbirth, adjusting to changing hormones and learning to feed and care for their newborn. That is also adapting to life outside of a warm, dark, cozy womb that provided constant physical connection to the birthing individual. And third, all of this is occurring during a time when the birthing individual is in need of physical care and emotional support themselves. It's important to remember that their ability to support and care for their little one is very much dependent on their ability to receive support and care themselves. So hopefully by now you have a foundational understanding of why postpartum is important to our work in early intervention. But just in case, I wanted to share this graphic, again from Root Therapy. They have some great resources for postpartum families and just one of many that I look to. This graphic is also included in one of your handouts. Thank you, Lisa, for putting that link again in the chat. So here, the Root Therapy has taken Maslow's hierarchy of needs and adapted it to relate to birthing individuals during the postpartum period. I believe this visual can help us to do an informal needs assessment for birthing individuals to determine what additional supports might be needed to support them and subsequently the child. Service coordinators as well as EI professionals can be instrumental in this process. by going beyond focusing on housing and food security to connecting families to parenting groups and supports, as well as connecting caregivers to employment and healthcare. Now, I'm not asking folks to research job fairs, but I am suggesting that this can be done similarly to how we make referrals for resources for food or shelter. This is a collective responsibility that we all have as we support families, not one that falls solely to service coordinators. We cannot and should not assume that a baby that is cared for has a caregiver that is also cared for. The health of the relationship between the two are vital to the child's overall health and development. So how do you know if a birthing individual is not okay? So if you guys can think of a time when you've gone in a home, or if you can just imagine for a moment a time that, imagine going into a home and something that a birthing individual might be doing that's not okay, that tells you that they're not okay, not they're doing something that's not okay, but that they are displaying behaviors that tell you that they're not doing okay. So I want you in chat to share a few of the red flags that might let you know that a birthing individual is not okay. Excessive crying, withdrawn, apathetic to a baby's cries, appear detached, talking too much when they usually don't, passive, they admit they aren't okay. Yep, that's good. That lets you know. Ignoring the child or being aggressive, overly happy and eager to give the right acceptable answers. Good. Thank you guys for sharing those. And you know what? Sometimes it's really easy and sometimes it's not, because we're starting the relationship with our families. And so we're still getting to know them. And so if we don't know the person and their personality, then we may not know if they're okay or if they're not okay. But it's important to ask the question. And something that I want you guys to practice is being okay when someone says they're not okay. Because oftentimes what happens is we want to rush in and we want to make it okay in the moment. I was at a presentation a couple of weeks ago, and they were talking about we live in a grief avoidant culture, which means that anytime we're put in situations that are uncomfortable, that we immediately want to try to fix it because we're uncomfortable being uncomfortable. So in that moment, though, where we're uncomfortable, then our focus has shifted. Our focus is no longer about the family, and our focus is on getting us out of the place where we're not uncomfortable. And there's a time and a place for that, right? So I'm not saying that you go into a home and we're talking about safety. That's not what we're talking about. But I'm talking about that discomfort with the emotional stuff that people are sharing or feeling, where we can't just sit for a moment with them and allow them to share what is it about this that makes them feel like they're not doing okay, and realizing that at the end of it, we may not have anything that we can fix this today. We may not have anything to offer the family today that's going to make them feel okay today. But what we can offer them is support so that if that is something that they desire, to get them on the way to being okay. So thank you guys for that. All of the behaviors and observations that you guys have listed can communicate that a birthing individual is not okay. So what I want to share here, this is another handout that you guys have, and we're going to talk a little bit through this because we want to know what to do, right? So once we've identified that someone is okay, and once we've given them that space and we've allowed them that space and time to share and get their emotions out, then we need to know what to do next, because that's our question, right? We want to know how we can support them. So what is our role as an early interventionist in supporting birthing individuals? So to answer that question, I believe, again, we have to go back to the beginning. So if you guys remember in the beginning, I asked about some of the questions that we were asking and to consider those. So I do believe that we need to review our questions. We have to rediscover the intent of the work. We have to dig deeper. In 2018, at our office, the TA and monitoring teams gathered information from local systems about functional assessment. Some of you may remember that. Local systems sent in copies of their family assessments with questions about that they asked families to inform the IFSP goals and outcomes. So in preparation for today, I reviewed several of those family assessments. And I must say, we asked some really good questions, but are they specific enough? Are we so scripted, or have we become so scripted that what should be a conversation becomes an interview that we must complete? Because there's a lot of work to complete. We've heard it time and time again about the administrative burden and all of the paperwork and all of that. And so it's really easy to shift the focus to that and away from the reason that we're doing this work. Now, I know we have requirements to meet, but those requirements are not barriers. They're only barriers if we take a glass half empty approach to our work. So I encourage you to spend some time after today's presentation reflecting on why you are asking some of the questions. And likewise, why are you not asking some questions? So back to the graphic. Birdsong is a fellow doula collective in Brooklyn, New York, developed this wheel of postpartum need. The purpose of this wheel is to identify what people typically need during the postpartum period. They believe that every birthing individual needs a little bit of each of these things during the postpartum period. The wheel can be used to assist practitioners or community members in identifying how to support postpartum individuals, or it can be a guide to postpartum individuals on how to prepare or ask for what they need. Because sometimes you just become so overwhelmed that somebody asks you what you need and you're not even really sure. So you just say that response, I'm good, when the reality is they're really not. So I'm going to review each of these items pictured and provide a description. While doing so, I'd like you to think about your role as an early interventionist, and if any of these needs you might be in a position to meet. So we're going to begin at the top, right here in the light orange, nourishment. So nourishment is not just about having enough food. We also want food that tastes good. Anybody a foodie? I love food and I love good food. Food makes me feel good. I like food that is familiar to me. I have, I'm sure you guys have some type of comfort food, right? So nourishment goes beyond just having something to eat. And it's about having food that tastes good and feels good. The next one, as we're going to move to the right, we're going to go clockwise, physical healing. So that's pretty self-explanatory. It's tending to yourself. So we're talking about that recovery time from childbirth and understanding that everybody's going to be different in terms of that process, because what the delivery is like and what was required for the child to be here is going to be a little bit different. And then the next one is that space held. And that's an active process of acknowledging someone's feelings, emotions, and their emotions around their reality. So somebody again mentioned earlier about holding that space. It is a combination of active listening and validating, not just giving advice. Sometimes we just need to be listened to, right? Even when we're talking, sometimes we're not talking because we're expecting an answer. We're talking because we just want an ear. We want somebody to listen to us. We want to be heard. The next one is a gatekeeping, and that is anyone that's honoring that person's boundaries, which we know can just get out of control during pregnancy, and it kind of spills over thereafter. It starts with the rubbing of the belly, when people just come up to you and rub your belly and don't acknowledge that, hey, this is my body. And it spills over to sometimes when you have people just pop up without even asking or not considering what might be going on or that adjustment. The next one is rest. And we're not just talking about sleep, but a time of reprieve, a time to recenter. So sleep is sleep, but you can sleep and not be rested. So it's important to remember that as well. Nurturing touch. So we're talking about hugs, cuddles, massages. It can be whatever soothes that individual. So as I explained earlier, I talked a little bit earlier about infant massage and the power of touch. And one of the things that we learned through the program was that touch is one of the first senses to develop. And it's also one of the last senses to leave when we die. And that was a powerful thing to me because it really just, I don't know, just thinking about it's there at the beginning and it's there right until the very end and how important and critical touch is. And so nurturing touch is another postpartum need. Postpartum intimacy. I know y'all like, wait, what is that? This is not about sex. Again, it's about that time alone. It's about somebody listening to you and not trying to fix something. It's about creating a space where you find your own pleasure, whatever that is. Maybe it's singing, maybe it's painting, but whatever that is. The next one is acknowledgement. And that's acknowledgement of the birth, the baby, postpartum, the healing, the sleepless nights, the whatever, all of those things that you guys listed early, just acknowledging that. Available joy. I love this because it makes me think about just being present and celebrating what's happening right now today. And even in this moment, you may be thinking about what you have to do when you get off this call, maybe later on today or later on this week. But available joy is really about just laughter and the ability to receive the joy available in this moment. So in this moment, as we sit together, what joy is available to you so that you can experience right now without the worry about what's going to come in an hour or 2 hours or 2 days or 2 weeks from now. The next one is resources, and not just for the child, but also for the birthing individual. That's important to remember. A kin keeper, someone else that handles the cares of the day. I wish I had that. I need somebody else to handle the cares of the day so that the birthing person can worry about themselves and their baby without worrying about what other people think, how other people feel. None of those things becomes the focus, but the focus is solely on them taking care of themselves and their baby. And last but not least, community. And that's a village, a support system, a community that serves and doesn't just take from. Identifying what and who is that to the birthing individual. So oftentimes when we think about support systems, we're thinking about the obvious. We're like, okay, well, your doctor's a support, your sister's here, so she must be a support. Is the dad involved, or is the spouse involved, or the partner involved? And that must be support. But again, it's support by the definition of the postpartum individual. So now that I've shared all of that, and I know you won't remember all of what I just said, so hopefully you've got something, some grasp from the different areas that we've touched on. But based on descriptions that I've shared, I'd like for you to drop a stamp on possible needs you feel like you can meet as an early interventionist. So let me tell you how to do the stamp. You're going to click on View Options at the top of the screen, choosing the caret, then choose Annotate, and a toolbar will appear. And there's a stamp option with different icons like a heart, a star. Do you guys see that? Good job. Thank you. Great. I see lots of stuff on acknowledgement, available joy, resources, community, nourishment, space held. Yes. Yes. Space, lots of space held, lots of acknowledgement, nurturing rest. Yes. Remembering that rest is not sleeping, gatekeeping, physical healing. Postpartum, yes, it looks like there's something on each one. And if you did not click something on each one, I'd like you to think about what that means and what ways because it's not scripted, right? Because there are ways that each of us can give something from each of these areas. So I just provided some examples of what those things look like, but it doesn't mean that that's what it has to be. So in the conversation, as we're building our relationships with families, as we're sitting with them, we're hearing what it is that they're needing, then there are different ways that we can support them in doing that. All right, if you haven't already, I'm going to ask that you exit out of the annotate toolbar. We don't want to take hearts and stars to the to the next page. They're great. Thank you guys so much. So embedded in today's presentation were strategies that can be used to support the parent-child relationship. And I've listed a few on the slide because I'm sure you guys are like, what strategies? Because it just felt like we were talking, or maybe I just felt like I was talking. And those things are observing and assessing the parent-child relationship. This is an ongoing process. So we are in a position where we're going into the homes a couple times a month. And sometimes less, but we're seeing families more often than really when you think about it. Some of the pediatricians are even seeing the children because the way the checkup schedule is, they may only see the child 3 times within 6 months. So we're having the most face time with the child in terms of a provider. And so as we're going into those homes, as we're seeing those children in their daycare settings or in their home care placements, then we're observing and we're assessing how those interactions are happening. Another strategy is to develop service plans that take into account the entire family. So think about the questions that we are asking. And I'm not asking you to write a goal for mom on the IFSP. I'm just asking you to think about what is going on in the family relationship dynamic that we might be able to include in some way, shape, form, or fashion in our service plans. The next one is to provide information, guidance, and support to families to further develop their parenting capabilities and the parent-infant or young child relationship. So coaching supports this process, right? Because when we are coaching families, then we are providing them with the information, we are encouraging them, we are building their confidence in what they are able to do for their child. There's so much judgment that is felt oftentimes by parents, and guilt and shame, because the world, I'll just say the world kind of generally is saying that there's so many things that we should be doing, and whether it's right or whether it's wrong. And so we have the opportunity with coaching to come in, if it's OT, PT, or speech, and to support families and to teach them specific strategies that they can use and to model those things and to be there as their cheerleader one-on-one as they are doing this. And I promise you, as we're doing that, we are building that parent's capacity, but we're also building that parent's confidence. The fourth strategy is to support and reinforce the parent's ability to seek appropriate care. So oftentimes we'll see people that are putting the needs of their child ahead of their own, often to their own detriment. And I'm sure you guys have heard the analogy about administering the oxygen mask to yourself so that you're in a position where you can help others, right? Well, we know that analogy, we can quote it, and we can quote it in many different ways, but oftentimes we aren't practicing that. So encouraging that, but also giving space for parents to share how hard that is at times to do that. But that's another strategy that we can also use. In summary, early intervention services provide the support to address the child's developmental needs by facilitating the building of caregiver competency and confidence in their abilities and linking them to additional supports as needed. As early interventionists, we have the unique honor and privilege of serving the most vulnerable citizens. But those citizens aren't just the children we serve, they are also the families. In order to support them well, we must ourselves practice vulnerability. We must model it. We must get comfortable with being uncomfortable when families share their experiences. We must focus on building relationships. As we begin to consistently practice professional vulnerability, we begin to make not only shifts in our mindset about the postpartum period, but also see the needs of birthing individuals and their families through their eyes. Thank you guys so much. We have our nice references here. And if you guys have any questions, you can feel free to share those in the chat.
Thanks,
And
Telisha.
I'm going to turn this over to Lisa, while you guys still feel free to put questions in the chat if you have them.
So I'm going to just go over some last minute logistics. Again, please feel free to type in any questions you guys have in the chat box. But first, what I want you guys to do is please, please, please go and head over to your email. You should see an email for today's webinar. There's a survey in there. If you don't mind going ahead, taking that survey, it really does help us during the planning process when we're planning these trainings. And so all of that information is really helpful. Once you do take that survey, a certificate will automatically populate. So you'll receive 1 hour of professional development training. And once it does, you want to make sure that you go ahead, you download it, you're going to save that to your desktop, and then you can print it from there. And then the last thing I just want to make sure that I mention to all of you is to make sure that you join us for our next Talks on Tuesday on October 5th. Again, if you're registered today, you're already good because you're automatically registered, as I mentioned earlier. And you really want to stay tuned to that because I think Telisha is really going to focus on specific populations, especially how to support NICU families as well as children born with substance exposure. But again, we'll check the chat for any questions. Telisha, I just want to thank you so much for that valuable information that you gave us. I think you gave us so much great things to really reflect on. I even love how you said to practice vulnerability. And like, I know for me, I even want to think about how, when you asked how scripted we are, I think, you know, that's a really key thing to think about and keep in mind because we want to hold those families in mind and really hold space for them. So lots to think about. And it's just been such a privilege and we're so thankful to you. You're getting lots of thank you messages in the chat box too. I don't see any questions, but a lot of thank yous and a great job.
Thank you, everyone.